Welcome to the Beverly Hills Plastic Surgery Podcast. I am the very casual Dr. J. Calvert. And today I do have the God Save the Queen socks on. Here today with the very fancy and coiffed Dr. Millicent Rovelo. How are you doing?
I'm doing very well. How are you?
I'm good. You just finished a day. You look very fancy.
Well, thank you. It was not intentional. I actually had a different outfit planned, and then I got to the gym this morning and realized I'd left that outfit at home. So I grabbed this one out of the dry cleaning pile in the back seat.
There you go. And then, see, that's where you can nickname your car the hamper.
I mean, it comes in handy.
It does. It's always good. Yep, my buddy Wallig called his nickname for his Subaru wagon was the Hamp.
The Hamp?
There you go. So, very handy. Well, you look great.
Thank you.
Regardless that you drew something from the hamper. And here we are. So today we're going to talk a little bit about thigh liposuction.
Thigh liposuction, because I feel like this is something that just about everyone wants. Every female at least wants some thigh liposuction. But there are some patients that are good candidates for it. And the ones that usually really want it are not great candidates for it.
Yes.
Is the problem. So let's go through that.
Yeah, you know, it's true. Like, it's really challenging to get great results with thigh liposuction.
Yes.
And it's an area of angst and dissatisfaction post-operatively for a lot of patients.
And their surgeons.
Yeah, and it's true. We're not happy either.
No.
I think there's a drag race going on out there. Hang on.
We are on Santa Monica Boulevard.
I know. Yeah. Every time we got to get it's either a siren or
a vroom. Yeah.
You know, if everybody drove electric cars, that wouldn't happen.
That's true. We still have the sirens.
That's true, but we are the electric car advocates of in the Beverly Hills area. Anyway, back to thighs. So yeah, the surgeons are unhappy because we want great results, and so let's start with the medial thighs because they're always a disaster to me. I think that medial thigh liposuction, what I always say is it's going to have to be very judicious and do not expect much. Do not expect a big win here.
So, okay, so let's talk about the different areas of the thigh. Medial thighs, that is that inner thigh area up at the top of the thighs. It's that area where everyone wants to have a thigh gap.
Right, groin adjacent.
Groin adjacent. That's the medial thighs. The lateral, or the outer thighs, sometimes referred to as the saddlebags, are the little outpouchings on the upper outer aspect of the thighs. And those are sort of the two focal areas that we'll discuss first. Medial thighs on the inside. My approach to that, some people have very fatty medial thighs compared to the rest of their thighs. I think those are the best candidates because it's a very focal area that needs to be addressed with liposuction, and there's an actual area of fat that you can take out of there. The ones that just have a little bit of extra fullness in there, those are the worst because, like you said, you can't expect a lot of change because the problem is you have to be really, as you said, judicious with the amount of liposuction that you do in this area. That skin is probably some of the thinnest skin in the body. It is not forgiving. And if you do too much liposuction in this area, you're going to get weird contour deformities. You're going to get lumps and bumps, and the skin's going to get droopy and saggy.
It is, and that's the thing. That medial thigh skin does not retract well after suction. It does not snap back, even in young people.
Nope, it does not. And it can just heal in a really wonky fashion. I've had to go back and do little mini medial thigh lifts after medial thigh liposuction because the skin just redrapes in a really wonky way.
And the patients don't understand it. Even though we say that, we say, look, this area is really difficult. It's really hard to get a great result. We have to be careful with it. They want a Hail Mary pass. They want you to make it skinny on there. And it doesn't work that way because the skin doesn't snap back.
It does not snap back. And that holy grail of the thigh gap really doesn't have anything to do with your actual medial thigh fat. It really has to do with your hips and how your thigh bones connect to your hip joints. Because some people can be really skinny and just have narrow hips and they're never going to have a thigh gap, whereas someone who may just be average size, but the way that their hip bone to thigh angle is positioned, they'll have a space in between.
That's right. And that space is not possible. Well, it's always possible. You can always do a medial thigh lift. Yes. You have to talk to somebody else about doing that because I am not a fan of medial thigh lifts. Are not on my menu of procedures.
Oh man, I'm starting to get on board with you on that. I have a patient right now that just has a bad infection after a medial thigh lift.
Because the neighbors of the medial thigh are not savory.
Yeah, I think you had
when
a special
it comes to infection.
It's true. She's had some interesting bacteria growing out of her infection.
It's like, where are you putting those incisions? Hello. It is in a very bad neighborhood.
Yeah.
One of the neighbors is a total asshole.
Yep, that's the term.
And it's just,
It's hard for hygiene purposes, for healing purposes. So a medial thigh lift is not a great option for someone that was trying to get just a simple thigh gap. So for this reason, medial thigh liposuction, you have to be very conservative with how much fat you take. And even then, you can have some problems.
Yeah, and I've been, very careful about how much I laser and Renuvi on there, too, because it can cause wrinkling and skin retractions and abnormalities that just make you go, ew.
It's because it's the skin. It's so thin. And it doesn't
it's not a good area.
Like the rest of the skin and the rest of the body.
So what I've done recently is I'll do like hand lipo there.
Yes, I've had good results with that.
Me too. And the patients want you to go for it. They want you to get in there and laser and suck everything out and power assist. And I'm like, no. You got to understand. I got to be gentle.
Super gentle.
I got to be really careful here.
Yeah.
And
the difference we're talking about here is hand versus power. Power assists liposuction. The handle of the liposuction cannula vibrates. And so it's a more power, and it's attached to a suction machine that's applying external suction. So you get a much more aggressive, fast suction or fat removal.
Well, there's a mechanical disaggregation of the fat, too, because the cannula is
vibrating.
Just like this. I don't know if you noticed that. I was emulating the cannula. But it's more like, and it really beats up the tissue. So the problem with that is that area, if you beat it up too much, and I'm going to tell you about a patient that was very close to me, and I'm not going to name names, but somebody I know very well who went for thigh lipo elsewhere. And, the surgeon was very proud. They got 300 cc's out of each medial thigh, right? Exactly. That's what I did. I went, It was 6 years before her medial thighs looked good. I am not joking. I am not even close to kidding. 6 years before it actually started to look, okay, this looks like it's healed. Because it needed to go through all the scarring and all the healing and then the turnover of the tissue and then hormonal changes. It needed 6 years to look good.
Wow.
So you have to be careful.
Yeah, you'd be really careful.
Most people don't have 6 years.
No, to look good.
To wait for the result. You say it's going to look good in 6 years, you wouldn't sign up.
That's not helpful. But the hand lipo that you mentioned, that's non-vibrating. That's instead of using a suction machine, you're just using syringes with basically manual suction applied to it through the power of your hand. And it is gentle. You're not going to get huge suction forces. You have much more control over where you're going. The problem with hand lipo is that you can't do it on someone that has a lot of fat in that area because it's not aggressive enough.
No, you'll be there for days.
So that being said, medial thigh liposuction is tricky, and don't expect huge traumatic changes if you want it to still look good.
What about lateral thighs?
Lateral thighs, I like. If someone has a distinct saddlebag, a little outpouching of fat in that area, liposuction is perfect. That's the absolute indication. Sign on up. We can help you with that.
Yes.
And I think just about everybody I know that's had saddlebag liposuction would do it all over again in a heartbeat because it's so helpful. It's that one area that you will never get rid of, no matter how skinny you get. And it just ruins the shape of your clothes and any outfit you're trying to put on. And so just that little area of liposuction, and people are over the moon happy. And you don't have to get aggressive. You're not trying to scoop them out. You're just trying to get that little focal area of fat removed.
Yeah, I like doing lateral thighs. Yeah. I get good results with it.
Yeah.
It works. It's forgiving. You just need to be smart about how you blend it to the rest of the thigh.
Right.
Which then brings you to two really difficult problem areas of liposuction: the anterior thigh and the under buttocks thigh. That are these areas, and knees. I mean, I'm not gonna,
knees. That's the next one.
Oh,
so I think I think I read a textbook somewhere that basically said don't ever liposuction the anterior thighs and under the buttocks. Although I know that plenty of plastic surgeons do.
Right here, dude.
Yeah.
But I don't do the under the buttocks. I'll tell you what I do there in a second, but go ahead. Keep going.
Yeah, because those are just really awful. If you do the under the buttocks in the traditional liposuction way, you can get some weird creases and folds under the butts. It's not a cute look. The contour changes. You get a banana roll. You get this little like extra buttock
like a banana
under the butt.
It's under the skin, and it's not cute.
And it's not cute, and it's not really that fixable.
If you've got a way to fix it, because I have probably 4 or 5 female patients in the practice right now that have a banana roll, and they're like, "Oh, but what can you do for this?" I'm like, "Nothing. I can pickle fork it. I can send you for some lymphatic massage. You're kind of hosed."
Yeah, that's what it is.
It's over.
Yeah, I mean, I guess you could cut it out, but then you have a scar.
Oh,
there.
no.
No, there's no good option for it. So what is your technique for the under the buttock then?
Oh, pickle forking. So what I'll do. So there
for someone that wants liposuction.
Right, they want lipo, but so here's the reason why. Just for Tracy in Wisconsin, why this doesn't work is that if you remove the fat from under the gluteal fold where the butt cheek meets the thigh, it's going to fall. You're taking away the structure.
Support of the buttock.
Right. Like there's something holding your butt cheek up, and it's that fat and those
ligaments,
that ligamentous, filamentous fascial connection to the skin. That lattice work is what holds it up. And then when you remove it, lo and behold, you get a banana roll.
Yeah.
Not cute.
No.
But so what I do for that area is I'll suction the medial thighs, I'll suction the lateral thigh. And then I'll just blend a little bit with that pickle fork cannula.
Just sort of push the fat around a little bit.
Well, more just to release what they're really bothered by is the cellulite.
Yeah.
That's the problem. It's not really the fat that they're just like, they think liposuction is the way to get rid of the cellulite, but what I'll do instead is just release all the septations that make the cellulite, but leave the fat, the structural element that holds up your butt.
Yeah.
And it works well. It's not 100%. Not 100%. But
it's better.
It is definitely better, for sure.
Yeah.
And then the anterior thigh, I agree. Like, stay away from it unless it's just, a train wreck and you have to try to do a circumferential reduction of the thigh. You have to be careful because contour irregularities, fat necrosis, problems that can occur there can really look bad. Yeah,
there's a reason we say don't do the anterior thigh. Mainly because the anterior thigh has the way the skin on the anterior thigh is attached to the underlying muscle is very thick. Like it's attached in a very thick ligamentous way on the top. So when you say anterior thigh, that means the front of the thigh where your quads are in the front. And when you start doing liposuction in that area and you start releasing all of those ligamentous adhesions that attach the skin to the underlying muscle, you get big problems because that skin really needs to be attached in that area. And if you start doing that, now you're going to have problems with fluid collections or seromas, with sagging skin, with loose hanging skin. So that's just an area that historically, we don't really like doing liposuction on, which brings us to the problem of the patient that comes in who wants basically circumferential thigh liposuction. They come in and they say, I hate my thighs. They're so big. Can you do some liposuction to make them smaller? And they don't have any focal outpouchings of saddlebags. Their medial thighs are not hanging out. They're basically the same width, from groin to knee. It's a straight line on the inside and the outside of the thighs. They just have big legs, and they think that they can't you just liposuction all the way around this and make them skinny? It's like, I can't. I really can't. I can do a little inner thigh liposuction on those patients, but doing outer thigh liposuction, if they don't have saddlebags, doesn't really make sense. And certainly you can't do a whole lot on the front of the thigh. So kind of limited. I kind of just turn those patients down and say, lose weight. I don't think thigh liposuction is, it might work. It might make your thighs smaller, but you could also be left with a lot of other problems.
How does that go over when you tell them to lose weight?
Not well.
I've been punched in the face. I don't think I'd ever
actually say those words, lose weight. I think I turn it backwards. I'm like, the only thing that's really going to help this is weight loss. And that seems to somehow go over better than you need to lose weight.
Yeah, they don't like that. They want a surgical option because it's, they've lived with the thighs the way they are for as long as they have.
Usually, because that's where their fat collects. Yeah. It's their problem area. And that's really, and I get it. That's really hard if that's your problem area and you just don't lose weight from your thighs. It would be great if there was a surgical option that could remove it.
Yeah, it's really hard.
It's really hard. What do you tell those patients who want the circumferential lipo?
A lot of times I will do a little bit of it. So I'll fan out from the medial thigh. I'll fan out from the saddlebag, and I will kind of do a circumferential thigh lipo, but I'm really careful with it.
Yeah.
I mean, it's not a lot that comes out. Maybe 100 over the anterior thigh. The your saddlebags can have 400 cc's, 500 cc's in them. Yeah. And the medial thighs, I'll do 100. I'll do 125 sometimes if I'm really careful.
Right.
But you have to be careful. You get a saggy medial thigh and you're bumming. It looks terrible. And it's not fixable anytime soon. You gotta wait. And that's just not, patients don't like hearing that. They don't like hearing that the answer to their problem is time.
Right.
Healing. Like your body must heal now. You had surgery. A surgical insult is a trauma to your body. It is an event where inflammation and swelling occurs, and it doesn't go away in 6 weeks. It takes 3 months to really heal, and maybe 4. And so I try to get people to understand that, because they think we had a girl recently who was like, I have an event on July, whatever. And it was like June 1st or May 30th or something, somewhere in there. And it's like,
it's not enough time.
Okay, but there's the surgical healing that needs to occur to actually get the result for lipo, for anything.
Yeah.
Is minimum.
You need time.
3 to 4 months.
Yeah, you can't rush that. You can't.
And patients want to make their own schedule. They want to say, well, I'm going to heal faster. And, you're not. You're not. Oh, are you from the planet Krypton? Are you Superman? Right. No, you're not going to heal faster. You're going to heal like everyone else. And you're going to heal a little better or a little worse than everybody else, because it's on a bell curve of how people heal. So in general, with the thighs, a lot of education needs to go into the discussions with the patients. You have to kind of temper their enthusiasm for medial thigh results and getting the gap, because everybody wants the gap. Guys don't ask for the gap. That's a female thing.
A chick thing.
Yeah, it is. But I think, with that said, good patient selection, good technique, I think you can get really nice results in the areas that you can get nice results.
Right. And the other area we didn't talk about are the knees. I kind of like knee liposuction in the right patient.
Yes.
Because sometimes you just have little fatty knees on the inside, little fatty pockets. And that's great. People love that when you can just get in there and get rid of the fat around the knees. The problem becomes usually in older patients who have some thin skin. If you're going to just do liposuction in that area, you get a lot of wrinkling, and the skin folds and they start to hang down, and they really don't like that. So
people don't like wrinkly skin around the knees anyway.
But that is a good place to add the Renuvion, I think, around the knees.
Yeah.
A little bit of liposuction and some Renuvion around the knees. So in the right patient, knee liposuction can be pretty good.
Yeah, and I do have a lot of patients that are always asking for like, can't you just lift the knees and skin?
I know.
And you can't.
There's literally
unless you're gonna have a big cut around your knees.
Yeah,
that's worse.
There's nothing for other than skin tightening devices like a Morpheus or an Opus or a Renuvion. There's no hope for those saggy knees, unfortunately.
The Morpheus, I think, is making its way to our practice. By the way.
Oh, I love to hear that. That's fantastic.
I got a very positive feedback from Orla that she thinks it's time.
I'm on board with that.
Yeah,
for sure.
And you like the face tight, so.
And I love the face tight. That we need to make happen.
All right. Well, that sounds good. Maybe we can get a little bit of that going with the thigh liposuction then too.
Yeah. No, for sure.
All right. Anything else on thighs?
No, that's it.
Say no to medial thigh lifts.
I do have one more thing because this comes up a lot.
Okay.
Patients come in, they talk about thigh liposuction and maybe they're good candidates, maybe they're not. But then they always ask or they mention or they reference, so all this is going to be smoother, right? And they're rubbing their cellulite. I'm like, no. In fact, it may be worse. So liposuction does not fix cellulite.
No, it doesn't.
Cellulite is a very superficial problem. It's a skin adhesion to the superficial parts of the leg or the subcutaneous tissue, and it's not an area that we even liposuction.
Nope.
So liposuction does nothing to address cellulite. Liposuction can actually make cellulite a little bit worse because it can introduce a few more little divots and lumps and bumps. So if you're trying to do liposuction to treat your cellulite, I hate to tell you, but it's not going to happen.
No, you have to, if you want to treat that, that's where my pickle fork comes in.
You need a good pickle fork. There are some other options out there. There's Selfina. There's the new Quo injection. No financial interest. No financial interest. And all of these work to some degree.
To some degree.
But if they worked amazingly well, you'd be hearing about it, and you just don't. So that tells you how well they work.
It's so true. But the pickle fork, I've had good results with that. I mean, I've had people come to kind of treat their cellulite, and I said, this is what I can do. It's going to be better, but it won't be gone. And they go, yeah. I'll take it.
Yeah. Pickle forking is when you sort of introduce this sharp instrument right underneath the skin and you break up those fibrous bands that are tethering the skin and causing the dimples. So it's literally a direct breaking up of those bands. Sometimes you need a couple rounds of it in any one area.
That's right.
To break it up. And you bruise like heck.
Yeah, you look like somebody ran you over with a bus.
Yeah, for like a couple of weeks. So no swimsuits for that time period. But you know what? Or you could just be like, you know what? 98.9% of females have cellulite. So, maybe just deal with it.
I think it's totally normal. I'm always saying to people, like, that's how people look. Like,
that is how women, unfortunately, look. Gosh darn it, the men with their beautiful legs. It's not fair. But women, we all have cellulite.
It's true.
It's part of the deal.
All right. Well, I think we're good on that then. I think we should probably do a whole pod about cellulite.
Yeah, we should.
Just kind of go through that.
Sure.
Maybe that's a future one for us.
Put it on the list.
Until then, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210. It's rolling. I set the levels earlier, so it should be good. Take your time. Don't choke on it.
This is how you do a Heimlich maneuver. We videotaped it for you.
Exactly. If you hear any random clicking sounds in the background, it's my son playing some random game. Sounds like we're at the office. It's interesting though. Like you don't really get all that sound on here. If you listen to our podcast, the sound is like insanely good. Really good. It is. It's really good.
I mean, Grant, Sean cuts out the
sirens.
Even still, the vrooming and stuff, you don't hear.
No, you don't. You don't hear all the air conditioning, all that. All right, let's go. Welcome to the Beverly Hills.